Hello, everyone. Can you hear me?
Yeah, I can hear you.
Okay, good. I can't see you. I think I set it up so you guys' video wouldn't come on automatically, but are you able to turn on your video if you want to? You don't have to.
Yeah, I can.
You can? Okay, good. There we go. Everyone, we're going to get started in a few minutes. I think I did something wrong with the computer, but I can see you guys now and hear most of you, right?
I can hear you.
Okay, good.
Yeah, sounds good.
Yeah, now we can do it.
All right, good. I was on a Zoom call the other night with another doctor, and my 10-year-old had got a hold of my settings, and I had like these green, I had like a green mustache and a green goatee. I was like, oh my gosh.
Did you see the thing where that happened to an attorney on a
Yeah.
hearing?
Yes, yeah. I felt like that. I was like so apologetic. I was like, oh my God, I'm so sorry.
I just love it when he's like, I assure you I'm not a judge or a dog, Your Honor.
That's very good. All right, well, thanks everyone for joining. We're gonna give it a few more minutes for people to join. And we'll get started here.
So are you feeling quite recovered?
Yes, I am feeling, yeah, back to my baseline, which, you know, was kind of tired and, you know, run down, but not due to the coronavirus. I'm feeling just fine. I admit to not getting enough sleep. So in general, I think my patients should do as I say, not as I do, but no, I'm feeling much better. Thank you, Beatrice. Yeah. So.
How long did it take you to get to this point from the onset of the virus?
I'll go over that in just a minute. It did, for me at least, it took a good probably 7 to 10 days for sure.
Mhm.
Maybe even a little bit longer, but I'll tell the full story. I'm going to give it a few more seconds.
Okay.
Maybe one more minute, and then we'll get started. I want to be sensitive of everyone's time. So
The OMICRon.
it was. I have no doubt it was OMICRON. It was definitely, because my symptoms were pretty classic, I think, for OMICRON. So I had a sore throat. I didn't have any, thankfully, I didn't have many, if any, lower respiratory symptoms. So.
Is the beard gone? Trying to say.
You know, when I had COVID, actually, I shaved. I was like, I just have to do something different. I wanted to, like, you know, like it was a transformative experience, but now it's coming back. There's a lot of gray in there, so, which was there before. And I don't know, my son told me, my older son said, if you shave and you let your shave fully, it'll grow back even more gray, but I don't know. But all right, anyways, we'll get started. I want to thank everyone for joining us. As always, it's good to see everyone. I really sincerely wanted to thank everyone for all their well wishes and their thoughts. And I was talking to another patient yesterday, and I really do view this as a community, and even to some degree a family. And I think the feeling is mutual, and it was really touching. And I appreciate everyone's well wishes. I wanted to be transparent, obviously, about what was happening, and I believe that's always the best tact in general. So, as soon as I knew I had that, I wanted to share with you. And also my intentions in sharing that I had this was to communicate, what was happening, because I know there has been so much fear and anxiety, and, there's a lot of unknowns throughout these past 2 years. And again, just speaking personally, for 2 years, I've thought I've had COVID. My family, I think they joke, and it's true. I think COVID anxiety disorder
Don't have a conversation over there because it will interfere with my hearing him. Here. Okay.
Yeah, I think, COVID anxiety disorder, I think is a real thing. It's not in the DSM-4 or 5 as an official psychiatric diagnosis, but certainly I think we all have felt that, like, oh, you have a sore throat, you're coughing, do I have coronavirus? And again, my family will joke, literally for 2 years, I was like, oh, I think I have COVID. And like, I've tested myself, I imagine more than everyone else on this call, although maybe not for some people, but I have access to tests. And plus, my fear always was not necessarily that I was going to have COVID, but I didn't want to be responsible for passing it on. And I think that's a sentiment that we all share. But so in some ways, having had COVID and getting to the other side, I do feel that some of that has certainly abated. I feel more relaxed, 100%. That being said, I still think it's better not to have COVID if you can avoid it. It was for me not an entirely pleasant thing, but it started. I'm 90% sure it was my son, my 10-year-old son, was the source of my infection. And I think that's the case. I really do think the more that we learn about this, the more I see in my practice, I think spread within the family unit is really the main way people are getting this. And it just makes sense, right? You spend the most time with these people, and it's just a fact of life. And his school, he goes to a private, pretty traditional Jewish school. And it was pretty, there was a lot of cases in his class. And I kind of felt like this was the time I was going to get it. And plus, in my practice, there was lots and lots and lots of people getting it. So I had a feeling it was sort of knocking on the door and coming for me. And then, my 10-year-old, thankfully, he's a healthy kid, and he had very little symptoms, if any. I mean, he had a fever and a sore throat for like a day and a bit of a headache. My symptoms were lagging probably about 2 days after his. And I could tell I just had fatigue. I knew I was tired. I had a headache, sore throat was starting, and it was I had muscle pain, which was pretty significant. And I kind of knew that it was coming, right? I had a pretty strong sense that this was my time to have the coronavirus. And interestingly, he tested positive on the rapid test that we have. I didn't test positive initially. And then I did my PCR was positive. And again, my symptoms primarily were sore throats, fatigue, muscle pain. I had a day or two of fevers, probably not terribly high, probably 100, 101. One night I had some shaking chills. So it felt, for me at least personally, it was definitely more than a cold, right? I would say it was more along a flu-like illness. And then I slowly got better. I mean, I took, Tylenol, Motrin, I took aspirin, I took some famotidine or Pepsi just because I was worried that my stomach might get irritated with all the ibuprofen and aspirin. And then, like I said, slowly I was getting better. Although the throat was lagging, my sore throat really kind of hung on for a while. And then at one point I was like, I was definitely I thought I would be getting better sooner, but it kind of lingered. And then I talked to my sister-in-law, who's an allergist. Some of you know her, Dr. Schreiber. And I said, well, maybe should I use some nasal steroids, like a little Flonase or something? Because I had some congestion too. And she said, well, I think just steroids in general would be better for you. So I took just a little bit of prednisone that we had lying around the house. And again, I don't recommend that without talking to me, and that kind of pushed me over the edge. And then by day 6 or 7, I was feeling, I would say, pretty close to normal. The fatigue lingered, and I would say it was probably a good full 10 days until I felt like my energy and it was back to completely normal. I will say I had one night or one day, a couple nights, I didn't sleep well, and I kind of got nervous about that. So I took, I think, a Benadryl at night one day, and then there was at about day 6 or 7, I was feeling better, and our furnace had an issue, and I was running up and down. I was running to the basement, and normally, I go up and down the stairs without a problem, but that time my heart was kind of beating a little bit, it was more rapidly than I would like. I maybe felt a little bit more winded than normal. And then of course the wheels start turning and I got a little anxious. And again, part of it is because I think I'm on this side and I know, I guess, all the potential theoretical complications that can happen with the coronavirus. And I was I having a blood clot, God forbid, or pulmonary embolism? But I think that was more anxiety. And I think that's a real thing. I was listening to another doctor talk about her experiences with it. And, I think the anxiety can really push you in a negative direction. But thankfully, I feel better. And I did not have a blood clot. And that was just one sort of episode. And now, like I said, I'm back to feeling totally normal, except I don't get enough sleep, but that's just a problem I have because I stay up too late and get up too early. But again, I wanted to thank everyone, and I'm gonna ask Will Bondi if he agreed to share his story. A lot of people have had COVID. I'm sure everyone knows people who've had COVID at this point. A lot of my patients have had COVID. I feel good that, like, obviously if you've been vaccinated, you're going to be just fine. And the other good thing is I think we really do have some good therapeutic options. I had a patient in his 80s who's got a significant amount of comorbidities, and we got monoclonal antibodies pretty quickly, and he did really well. The monoclonal antibody story is a little hard now because Omicron seems to be responds only to one of the 3 that are available, and there is a shortage of that. So that's not ideal. And again, it is more of a procedure to get monoclonal antibodies. You have to go to a facility, you have to get an IV treatment, but there's a couple different oral therapeutics as well that are available. There's the Pfizer and the Merck product. I think the Pfizer is a little bit better and has a little bit more data, and I feel a little bit more comfortable with it. And I've prescribed it on a couple of different occasions. I think it works best if it started very quickly, certainly the data looks like if it started within 3 days, it's most effective. But even sooner, and if you don't mind sharing your story, we started, Will's treatment in, I think, hours of his diagnosis.
Yeah.
It seemed to help. So
Yeah. And I'd be happy to go into all that if you ready for it.
Yeah.
Yes. Yeah. So I've been known Dr. Sadikman now. I just looked at it. 7 years we've known each other. We actually met on my 30th birthday. I don't know if you knew that. I accidentally scheduled an appointment on my birthday.
I don't know that.
So like Dr. S said, I'm actually been a COVID anxiety person as well. I'm just an anxious person with things I can't control in general. So I know exactly what you're talking about, feeling the shadow of COVID coming up behind you there. But so on a little background on myself, I'm 37. I have a few comorbidities, like I'm overweight and have high blood pressure. High blood pressure is treated, and I'm working on the weight. Actually, I have a dietitian appointment after this. But so I have a family, my wife and daughter, and been concerned about it for myself and particularly my daughter. She's 2. She can't get vaccinated, of course. We do everything we can, but a 2-year-old is going to be a 2-year-old, and she does go to daycare. So just to go over a little bit about what happened with me on Friday, it was January 21st. I woke up feeling just a little bit off. It's hard to explain, just like one of those things like, feel a little off. And I had a bit of a runny nose, and I'm not a runny nose person. When I have allergies, I'll get congested, that sort of thing, but I don't get runny noses. So I took a rapid test that I had in the middle of the day, and it was negative. And I figured, okay, that's just my COVID anxiety that decided, a little dust in the house or something like that was COVID. I felt that little offness the rest of the day, but I hadn't slept well. My daughter had gotten up in the middle of the night and done the normal 2-year-old stuff. Saturday, I got a better night's sleep, and I woke up feeling the same kind of offness, but a little bit more intense and a little bit more runny nose and a little congestion. I figured, you know what? I just got a bunch of rapid tests. I'm just going to do it. It's just a mind exercise to calm my anxiety. So I took it, and I let it, you have to let it sit 10 minutes or whatever. I went off and did something. I think it was putting away some laundry. Come back, it's like 4 minutes later. Solid line on the positive. Like, I didn't even have to wait the 10 minutes. So I immediately texted Dr. Sadikman, and again, thank you so much for being available like that. And I actually heard your voice when you said "oi," which is your response. I heard it in my head. But knowing some of my comorbidities, Dr. Sadikman said, "Do you want to see if you can get Paxlovid?" And I said, "Yes." And being the kind of person I am, I'm a software engineer. So yes, don't take any medical advice from me. Let Dr. S handle that. But I had actually known that the federal government keeps a website called healthdata.gov that tracks where Paxlovid's been delivered and the current inventory. So I called one place that said it had available. I did not realize they were closed on Saturdays. Second place I called, they said, "Oh yeah, we've got plenty of it." They had like 180 some courses left out of 200 they'd been delivered. I was up in Laurel, Maryland, but I went there. Dr. S sent it in. Went there, zero issue. The only thing I had to give was I did have to give a Maryland license, and they said it sounded like they had to verify that you're a Maryland resident to use up some of Maryland's allocated supply. Of course, I live in Maryland, so no problem there. And I took it just before 11 a.m. and I had gotten the positive test at, I don't know, 9:15. So less than 2 hours of turning positive, and maybe 25, 26 hours since what I then knew were symptoms that I the previous day thought were just my COVID anxiety there. What was interesting about that is when I went to go pick it up, because it's 45, 50 minutes from my house, my wife did a rapid test and my daughter did a rapid test. They were both negative, though my wife said, I noticed Rachel, our daughter, her nose is a bit runny. So we're like, okay, let's do a PCR test for you two. They went to the same day testing in Germantown, which is right near our house. And we found out a few hours later that my daughter was COVID positive too. So that was obviously a very anxiety thing, just because, it seems like there's not much you can do for 2-year-olds. But when I came back, I went ahead and isolated myself in our master bedroom because it has its own bathroom. And my wife decided, she's like, I'm just going to mask up real good. Like me, she's triple vaccinated. She does not have any comorbidities, though. It's just as you said, I'll watch Rachel, N95 in the house. But she told me later that she kind of was like, there's no way if you both have it that I didn't get it being in the same house. There's just not a chance. So she said in some ways the mask was just theater in hindsight. But when I got home and I took the Paxlovid actually before I even left the parking lot, for the rest of the day, that runny nose and congestion with a little bit of cough got worse. And I also, that offness feeling I described, it went from just slight to like, I'm sure everyone here has had the flu or something like that at some point in that life where you really feel, oh yeah, I'm getting sick. That just kind of increased that offness feeling. I never had any fever. I never had any muscle aches. But in about 4 to 6 hours after taking it, what was interesting was there had been a clear crescendo of those symptoms. It just kind of leveled off. And when I went to bed that night, I took some NyQuil just because I was coughing a little and tried to sleep, and I did. And I woke up the next morning, less than 24 hours after taking the first Paxlovid, and I felt better. Not 100%, but I could feel that it was now going, the symptoms were improving. The intensity was dropping. What remained, though, was that somewhat annoying cough, somewhat annoying congestion, and runny nose. But I noticed that what had set in was I was very, very tired. So I ended up sleeping a lot Sunday and Monday. It was one of those things where I'd get up, eat breakfast, kind of doze off watching some TV in the master bedroom, that sort of thing. But I never felt that bad. One of the things a friend asked me that I thought was very analogous, we've all had those flus where you're just shaking, you're either burning up or frigid and miserable and achy. Compared to that, it was not nearly as bad. Now, the anxiety part of it, knowing you have COVID, that was way worse. And I've had, unfortunately, 2 family members pass from it and things like that. So I've taken it very seriously. And in fact, another friend of mine said, if Will got COVID, that means we're all going to get it. I don't know how true that is, but yeah, I don't know how true that is, but yeah, to give you some reference, I've literally been in a restaurant once in the last 2 years. And my wife, being a scientist for Merck, she's trained in viral protection and stuff like that. So I am super careful with that stuff. But so that super tiredness continued Monday. And then Tuesday, that it's really, the tiredness started lifting. And then my symptoms of the cough, runny nose, congestion really started lifting very, very significantly on Tuesday. So we're at that point, 1 to roughly 3 days from starting Paxlovid. And by Wednesday, I was feeling close to 100%. Not 100%, but close to it. And what I did notice, though, was my voice sounded awful. But from that coughing I'd mentioned earlier, even though it wasn't constant, for me, it was when I had those fits of coughing, it was very, very intense. And I'm sure I just irritated myself there. I never had a sore throat, never had a fever, never lost sense of smell, never lost sense of taste, which is very fascinating to me because for it seemed like the first 18 months of this, that was the thing you really looked for. That was the unique COVID thing. Never had that. My wife did get COVID. She was triple Moderna vaccinated. I was triple Pfizer vaccinated, but she had it much closer to when we had COVID because her lack of comorbidity, she didn't get approved for the third shot till later than me. She had what she described, for reference, a cold that felt a little bit more intense, but she said barely. She said, I would have taken that over the flu any day, no question. But this is one thing where Dr. S, perhaps you'll find interesting and be able to elaborate on some of your experiences in a bit. My wife still has small amounts of symptoms from it about 10 days later, whereas I'm pretty much good. And I'm curious, I wonder how much Paxlovid played into that. Because she didn't have any, she wasn't eligible for any of the treatments, that sort of thing. And to be fair, she herself has pointed out, probably didn't need it based on her experience. One of the things I was saying to Dr. S in the email, though, the way for me that there was a clear peak and started going down in intensity of symptoms with Paxlovid, that was something that gives me real hope for the future with COVID. And it's since, you know, I think most of us have accepted that it's not just going to go away. But that gave me a lot of hope because of how much it improved it. And I hope the supply continues to increase and increase. Excuse me. One thing I did want to address, though, I saw some news stories that were, typical, oh my gosh, is this stuff safe? What are the side effects for it? And I do understand from the insert that came with it that there are some drugs that do have real interactions with it. I don't take any of them, but also I've heard stories about side effects. So I thought I would share that too. I did have a couple of side effects that were so minor that I would not think twice again about taking it. One of the things that was interesting was it had apparently something like 60 or 70% of people experience a bitter taste in their mouth. And that was fascinating because it was the most interesting thing. It wasn't miserable or anything, but you could not do anything to get a bitter taste out of your mouth. I had a piece of toast with jelly on it, still bitter, even though it was obviously something kind of sweet. It did give me some heartburn, relatively mild. I took some OTC famotidine after talking to Dr. S, seemed to take it under control. And the only other thing is I monitor my blood pressure and it was slightly higher. I'm normally like 120, 78. It was like 125, 85. Nothing scary, but those were the only things I experienced with it as a side effect. Let's just check my notes here. The other thing too is I do have a pulse ox. I never experienced any of the shortness of breath. There's never a low oxygen reading, that sort of thing. So I don't know how much of that is just me versus, getting treated pharmaceutically, that sort of thing. But my experience, like Dr. S, I went in with the COVID anxiety. My wife keeps joking about she's nervous because she hasn't gotten the I told you so, because I was finally right that I had COVID. But yeah, having been through it, I can't reiterate how much I truly believe and hope and pray that this becomes more available, because it really did give me hope for trying to get back to normal there. So I have to go at 3:00 for another appointment, but I'm happy, Dr. S, if there's questions or anything like that to elaborate on my experience.
Yeah, certainly. I mean, I'll just start off. So again, thanks so much for sharing. I really appreciate
Sure.
it. I think it means a lot to everyone. In terms of that bitter taste, how long did that last? Is it the medication
so
afterwards, or?
It started maybe a day after I started taking it, and it left pretty quickly after I stopped. And it was not something that like you would sit there noticing it. It was just like, huh, that is weird. They weren't kidding, you know? But it didn't cause any problem besides just noticing it.
Okay, all right, thanks. I mean, I think your point is right. I think the medicine, I think it clearly did help you, and probably did help resolve your symptoms. I had another family member, another couple who both got COVID. One of the patients got the monoclonal antibody treatment, the other one didn't. And his symptoms resolved completely, and her symptoms still lingered, a little bit, probably longer. So I'm sure it was related to the therapy. But I'll let anyone else ask you questions before you have to go. Well, if anyone has a question, you can just unmute and go ahead and.
Yeah, I'm happy to help.
Did you have any idea where you got the virus from?
Yeah, okay. So to give the little backstory with that, my daughter, as I mentioned, she tested negative on a rapid test that same Saturday. But what was funny was I was still sitting on the table a little while after the 10 minutes, and it had started to show a very, very faint blue line. I don't know if it's invalid at that point or what, but it was just kind of a huh moment. My wife being in science and me being in curious, we actually did try it again the next day, even though we had a positive PCR. And it was clearly negative then. In talking to the state of Maryland, when they did their assessment and I told them this story, they said that they assume my daughter brought it home from daycare. She actually loves wearing a mask at daycare. Believe it or not, for a 2-year-old, I'm very thankful for that. But it's still a bunch of 2-year-olds. So it's presumed we got it there and she brought it home. My wife and I have perfected the art of being hermits. So I just think logically it makes sense, but I can't prove that.
I think it was. Is your daughter okay, by the way? Well,
Sure.
Yeah, she only ever had a runny nose for about a day. It was the most non-incident. And if we had not gotten sick, I don't think we would have ever known, because you guys know how little kids are. They just have a runny nose sometimes and that sort of thing.
Right. Oh, that's wonderful. Yeah, I think it's clearly from your daughter. That's my assessment, because of anyone, like your friend said, if you're gonna get it, I mean, like, you have been so careful, this whole time, thankfully. So listen, I think family spread, household spread is very common, and probably the most common way that's transmitted other than school. And we're seeing more of that. Although lately I've seen, very thankfully, it seems like the cases really are diminishing locally, or at least in the practice. And I think it's represented in the statistics in the school as well. So, the kids, they are strong and their immune system is so strong. Like I said, my son too, he had a fever for a day and a headache. And then, like, if I didn't know he had COVID, if I didn't tested him or before I would have sent him back to school on day 3. And, I wouldn't have thought twice about it. He probably still would be infectious and continue to spread it, but it is what it is. But oh, Naomi, are you raising your hand? Did you want to unmute yourself and ask a question?
Yeah,
Okay.
right. So I just sent that in the chat.
Oh, okay.
The question is, do you have any thoughts about the efficacy of monoclonal antibodies with Omicron? I'm assuming this was an Omicron infection.
Yeah,
or do you know? Do you not know? I don't know.
Yeah, I mean, I think for me and I'm assuming yours was Omicron. Well, although we don't know, obviously.
I don't know, but I read in the paper recently 99.9 and several digits 9 are Omicron in the US now. So I don't think I feel like I'm not going to be the one exception.
Yeah, I think the monoclonal antibodies, and again, well, thanks again for sharing. And
I'm happy to anytime.
My perspective on the monoclonal antibodies is they're effective and they work. In terms of Omicron, it seems like there's only the one of the 3, and I'm going to botch the pronunciation of it, the one that starts with an S, acetylminivir, whatever, that's effective. The problem with that is that there really is a shortage of supply, and it is more involved in order to get it. I've had several patients go through that process, and thankfully it's been pretty smooth, but the logistics of ordering it, getting it done, getting it, and then getting it administered can take some time. And the beauty of the Paxlovid is, if it's available, you could call it in, you could start it. I mean, Will literally started taking it within a day of his symptoms, and within hours of being diagnosed. So, and that seems like that is the window. The way the Paxlovid works, it inhibits an enzyme that the virus uses to replicate itself. So I think the sooner you start it, the less sort of replicating active virus there is circulating in your body, the better you'll be. So, but
Yeah, and I just wanted to add one thing before I jet, Dr. S, that if anyone has to look for it, first of all, I hope you don't have to, but healthdata.gov has a way you can look at the deliveries and how much is remaining. It's up to date within 24 hours now. And I just hopped on that and started calling.
yeah, healthdata.gov. Yeah, I had one other patient that we prescribed it to. His case, it was a little bit longer before he was diagnosed and then treated. So I'm not sure it was quite as effective as it was in your case. And I really, the data looking at the Pfizer study, it's clear that if you start it within 3 days, for sure it has to, I think 5 days for sure, but within 3 days, it's even better, the efficacy. So, all right, thanks a lot. What was that website again?
Healthdata.gov.
Okay.
And additionally, so you can actually create reports and request them to be made public. I made one for the area around us. I have requested for it to be made public. So hopefully I can get a link that you could just share with people and see places nearby. Again, I had to drive about 45 minutes, but well worth it in my experience. And my hope is someday this is something like, we could almost just have available in the medicine cabinet in case something, and you test positive, but we'll see. I know they said they've delivered 250,000 and supposedly it's going to be 20 million by the end of the year, but yeah.
It definitely seems like it works, and hopefully it'll continue to work. And I don't, by the mechanism of action of the way that medication works, I don't think any variants would change that process because it really affects the way the virus replicates itself, right? So I will say that obviously we all know people, and every patient that I've had so far who's gotten COVID has been vaccinated and probably boosted, actually, now that I think about it. Actually, there was one 16-year-old kid who was just vaccinated and he wasn't eligible for a booster. But the point is, I guess the vaccines that we've all gotten are specific to the spike proteins from the original Wuhan's native strain. And obviously the Omicron variant is so significantly different in terms of some of the proteins on the spike protein that I think the circulating antibodies, and certainly whatever sort of B and T cells we have, I think help for sure, but not really to the same degree that we would hope. And I know they're working on new variations of the vaccine that will be more specific to sort of what's in the community now. I've had today 3 patients separately on my schedule when I saw it today asked me, oh, can I get a 4th shot? And I know they've done that in Israel. That clearly isn't been recommended, hasn't been studied, isn't approved. And at this point, I think I'm not recommending that at all. I would wait and see how things play out. And if you are going to get another vaccine, I would certainly wait and see if there's a new version that is more protective against what's out there now, right? Which is clearly Omicron. But like I said, things do seem to be getting better for sure, at least in my patient population, and I think in the community in general. So I'm optimistic that, in the next month or so, things will look better. There'll be little, if any, circulating virus. I think at this point, so many people have been, at least in Montgomery County, been vaccinated and or had the virus that I think we're going to be in a pretty good spot until the next variant comes along, which I think probably will happen. That's just, it seems like there is a cycle, a pattern that's unfortunately happening every, 4 to 6 months. There's a spike depending on what's out there. And I don't know, hopefully I'm wrong. I've sort of been wrong all along in predicting what's going to happen. I know in the very beginning in March of 2020, I told my kids, oh, we'll see after 2 or 3 weeks. I think this will be better and you'll go back to school and there'll be no problems. But at this point, it's been 2 years, so who knows? But Anyone have any other questions or thoughts or want to share any of their experiences? Feel
Um,
free.
Could I interpose a yes or no question?
Sure.
Forgive me, the other people, for even asking this, because I didn't have COVID. I tested negative all the way. About 2 months ago, you prescribed for me taking B12 for a couple of weeks. And I didn't get to talk to you in the last 2 months. Should I still be taking that B12 or not?
Yes, you should.
Okay,
Yes.
that's all I wanted to hear. Yes or no?
And to that end, when I had COVID, I didn't take B12. I took vitamin C, zinc. I'm not sure if it helped or not, but I felt better, doing something. And I think all of us do. I took aspirin, which I think is important because I think people, although with Omicron, that doesn't seem to be the case as much. But I think one of the more, I guess, serious complications of COVID infections is, people can get coagulation disorders, people get blood clots. I think people will get pulmonary embolisms. Actually, I had 2 patients who were both had pretty significant medical problems, were quite older, who had COVID, thankfully were fine, but they both had blood clots, and it was strange in their lungs, and they didn't really have many respiratory symptoms, and their oxygen level was fine the whole time. So I was taking an aspirin the whole time, and I think that's, in general, a good policy. A baby or even a full dose aspirin, I think if you get COVID, I think is a good thing to do. And like I said, I took a little Pepcid as well, just to protect my stomach. And early on, there was some data that maybe Pepcid was helpful, but that was, again, with earlier strains. So I really do think it was encouraging to hear Will's story that he got Paxlovid, that he got it so quickly, and it seemed to help. Like you said, the monoclonal antibodies are another therapy. I know other people have gotten them, and again, that's also a wonderful thing. But it is
About his online Zoom session.
Oh, I'm there. Can you hear me? Sorry about that. I'm
Yes.
optimistic for the next, what this sort of outlook is, at least for the next 3 to 4 months. But beyond that, I can't say. So. All right, good. Are there any other thoughts or questions? Otherwise, I really appreciate everyone's well wishes and their thoughts and concerns, and it was touching to see everyone's response, and I was very appreciative of it. And
Yes.
and again, my goal in sharing what I was going through was not to get that response, but was to kind of share, just to communicate, like, listen, this is going to happen, and I wanted to share your experiences and my experiences. And I think thankfully at this point, I really do feel if you are my patient, you're going to be fine. No, if you've been vaccinated and have access to medical care, I really think you're going to be fine. And it's at the point where I think it clearly is approaching, if not endemic at this point. It's going to be part of our, it's going to be part of our community of viruses that we're going to have to just, I think, deal with and live with. And I hope we get to the point where the kids, to be honest, the other takeaway from this is I really do feel bad for the kids. I mean, seeing what my son went through, which was, literally he had like a day or 2 of symptoms, the fact that he's been pretty relaxed about it the whole time. And his school, thankfully, has, I think, been pretty good about it. I mean, they've been taking it seriously, but they've also not created too much fear and anxiety. But I do worry about the fear and anxiety that we've instilled in our kids, and what hopefully there won't be long-term effects of that. But I just feel bad that these kids have missed out on 2 years of normal life. And for them, obviously, 2 years can be anywhere from 20 to 100% of their lives. So it's that was
It's nice to see you without your mask.
that's true. And I think at this point, I'm comfortable. I do feel like I have a pass now that I've had COVID. I feel more comfortable not wearing my mask in certain environments. And, I had a patient who I saw that day who also had COVID, and I had COVID, and we're like, well, you know what? In the room, it was nice to examine, to be face to face with someone without wearing our masks. And I felt totally comfortable in that. So, but again, at this point, I think we need to be just respectful of everyone else, and be sensitive to other people. And I'm hopeful. I'm optimistic that in the near future we'll be semi-normal. So, okay, very good. Yeah, go ahead.
You felt more comfortable with someone else who had COVID. Are you saying that just because you had COVID, you can't get it again?
Well, that's a good question, right? I mean, I guess it's theoretically possible. And in fact, I have a community of family friends who got COVID 6 weeks ago, and then they all just got COVID again with this Omicron variant. So I don't think that, but I feel good knowing what's out there in the community. I think now I feel more comfortable, at least for the short term.
Well, I'm fearful if the message out there is if you've had COVID and you've had Omicron or one or the other, you're okay not to wear a mask now.
Well, like I said, I think you just need to take it depends on which environment, right? Like, again, in that case, the patient and I both had COVID, both had clearly had Omicron. So I think there was and we're feeling okay. I mean, I think at some point we're going to need to return to a point where we don't wear masks. And I know we all feel even I still feel more comfortable, wearing the mask, even though the truth is, unless you're wearing an KN whatever 94 and N95 mask, I think there's data that cloth masks probably aren't doing much. So
public places, I'm going to wear a mask at this point.
No, I don't think that's wrong. And I think people will continue to do so. In fact, I saw a patient today who's like, well, I'm going to keep wearing a mask regardless. And again, I don't think that's wrong. And I think we need to be respectful of that for sure, right? And create an environment where that's okay if that's what you want to do. I think there was a period last year when Montgomery County lifted the mask mandates, right? I think we're probably going to get to that. Just my sense is in the next 2 months. I think this wave will really crash, and there'll be little circulating virus. That being said, in certain Asian countries, they wear masks all the time, right? I mean, there's other viruses out there. There's still influenza that's probably circulating, although I haven't seen much lately. A couple months ago, I had a couple patients get the flu. There's other respiratory viruses, there's bacteria. So, I think if people feel more comfortable wearing a mask, they should, continue to do so. But I do feel personally in the community setting that I am in, having had COVID, being vaccinated, having had COVID, like, I think when Montgomery County says you don't have to wear your masks, personally, for my own health sort of profile and what I've been through, I'm not going to wear a mask. I don't think I'm going to go to the Verizon Center anytime soon to see a concert but again, if you want to do that, I don't think that's wrong. Again, like I said, I think there's been so much. This is a unique experience, right? None of us, I don't think, have lived through anything like this. But the fact that we're living through it in the day and era that we are living in, when there's so much information, so much access to information, and there's so much information being pushed at us constantly with our phones, that it can be confusing. And I think it's created an environment of tension and even anger, which I think is fueled by anxiety, really, and the media. But I think we need to be tolerant and understanding and compassionate of one another. And I think I think that's my main goal moving forward. It's like, listen, everyone needs to do what they want to do for themselves. at this point, listen, in Montgomery County, I don't know what the percentage of people have been vaccinated, but it's very high. And I think we need to just to move forward knowing that in a tolerant, open way and be understanding of one another and be kind to one another. And if someone's uncomfortable, I think you need to be respectful of that and listen to it and not get upset at the people, Not that anyone in this community or in this Zoom meeting is like that, but that's what I fear is like, this is just, and again, I'm not making any comments about politics, but I see that there's so much anger and anxiety that my hope is that we can move past that in a calm and peaceful and loving way, but I don't know. I do think that, and again, now that I'm sort of went down this road, I think like I said before, I feel bad for our kids and our college kids. I mean, and I'm speaking personally, like my daughter, who many of you know, is in her third year of college. And 2/3 of that experience has been, maybe more, actually more, has been, shadowed by the coronavirus. And again, not that, I mean, it is what it is, but I just feel bad that she won't get that time back, so. What are we gonna do? I don't know, but again, I do feel optimistic that we have some therapeutics, that we have vaccines that are protective and to some degree, and I think everyone, if God forbid you were to get the coronavirus, you're gonna be okay, and we're gonna make sure of that. All right. I still think it's better not to get it. I mean, my symptoms, it wasn't much fun. So at first I was like, oh, we should all do, I was thinking to myself, maybe it'd be better if everyone were to get this and we'd move past it, but that's not the right answer, clearly. I mean, and even there's a neighbor of mine got it. It may have been from my 10-year-old playing with their kid, I'm not sure, but she was quite sick. And again, she was vaccinated. She hadn't been boosted yet. I'm not sure why. I think her vaccines were still within close to the 6-month window, but my booster was in September, so I think whatever circulating antibodies I had were very low and probably didn't do much. She was pretty sick, so I think if you can still avoid it, it's better. But if you do get it, I think we have some therapeutic options, and we're all going to be okay. So. All right.
Thanks much.
Dr. Sadikman,
Yes.
do you have any, you said that possibly in 2 or 3 months, things will certainly be different than they are now. But for those that don't have the virus, is there any suggestions of what additional supplements maybe we should take? I heard you mention a few, or any action we should take in the next 3 to 4 months to try to avoid getting the virus.
No, I don't think so. I mean, I think just continue doing what you've been doing. And I mean, I think there is zinc and vitamin D can be helpful. But beyond that, I think, I think everyone needs to make decisions that they're comfortable with, and they should continue to do so. And I think we're going to be okay. I know that, actually. I know we're going to be okay.
Good. Thank you.
No problem.
Am I correct that
And
vitamin
thank you for
D
sharing.
Vitamin D is sun?
Sun, exactly. Yeah. So go to the beach or Florida or take a vitamin D supplement. Maybe not Florida, but do whatever. Again, at this point, I think we all just need to do what we're comfortable with and follow the words of Ringo Starr with peace and love. Peace and love, right? All right.
Yes, sir. Thank you. Thank you for sharing your ideas and the gentleman before you.
Okay, yeah, no problem. All right. We'll talk to you all later.
Thank you.
You're welcome.
Thank you.
Okay.
Bye-bye.
Thanks, doctor.
Okay, take care.